Level 1. Irritating venom. Irritating venom is the least dangerous. These venoms may cause scratching, swelling, or irritation, but they are not harmful. Common examples are fire ant, caterpillar, and small bee stings. The venom mostly comprises formic acid or histamines, which cause redness, itching, and swelling. Solanopsin, the fire ant's venom, feels like a searing needle. This dose of venom is irritating but not dangerous unless you're allergic or repeatedly stung. Since many of these stings are so common, people develop a natural resilience. It may hurt, but it normally goes away within hours. Level 2. Localized pain venom. Acute localized pain venom is more intense than level 1, but not medically harmful unless allergic. Examples are wasp, hornet, and honeybee venom. These species employ venom for defense, not hunting. Malitin attacks cell membranes and stimulates pain receptors. A honeybee's sting releases venom quickly, causing scorching, throbbing pain and inflammation. Apitherapy, which treats arthritis with modest dosages of bee venom, is beneficial. A single sting might cause minor discomfort for most people, but bee allergies can cause life-threatening anaphylaxis. Most of us find it uncomfortable but manageable. Level 3. Tissue-damaging, necrotic venom. This is when things become serious. Necrotic venom kills. It breaks down and rots tissues at the cellular level. Brown recluse spiders are notorious. Its venom contains sphingomyelinase D, which causes necrosis by destroying cell membranes and blood vessels. This venom is harmful because it causes long-term damage. Symptoms may occur hours later, revealing open sores, charred tissue, and painful ulcers. In extreme circumstances, skin grafts or amputation may be needed. This venom seldom kills, but it can cause severe disfigurement and excruciating pain. Level 4. Hemotoxic venom. Hemotoxic venom attacks the blood, and this level is particularly gruesome. It interferes with clotting, damages blood vessels, and causes massive internal bleeding. Snakes such as vipers, rattlesnakes, and boomslangs are known for this type of venom. Hemotoxins break down red blood cells, cause uncontrolled bleeding, and lead to intense bruising, swelling, and shock. What makes hemotoxic venom particularly horrifying is that it slowly destroys your body from the inside out. Your gums might start bleeding, your urine may turn black, your limbs may swell grotesquely. Without anti-venom or quick medical treatment, the results can be fatal. The good news? Antivenoms for most hemotoxic snakes exist. The bad news? You still have to survive long enough to get to a hospital. Level 5. Neurotoxic venom. This level tackles your nervous system, your most vital. Neurotoxic venom disrupts nerve muscle transmission, causing paralysis, muscular failure, or respiratory arrest. Cobras, coral snakes, and black mambas kill victims instantaneously with neurotoxins. Black mamba bites can kill 10 adults with poison. Dizziness, muscle weakness, and collapse commonly follow a sensation of doom. Death can occur within 30 minutes without anti-venom and life support. Neurotoxic venom is particularly evil since it kills without pain, like turning off your vital functions one by one. Level 6. Cytotoxic venom. This venom doesn't just destroy tissue, it melts it. Cytotoxins are designed to break down cells and connective tissues, leading to severe inflammation, blisters, and gangrene. Creatures like the saw-scaled viper and some species of sea snakes use cytotoxic venom to weaken or kill their prey slowly and painfully. The destruction caused by cytotoxic venom is often visible. It creates open wounds, pus-filled blisters, and festering ulcers. Victims may lose fingers or limbs due to tissue death. Even if the venom doesn't reach the heart or lungs, it can destroy muscle, skin, and bone at the site of the bite, resulting in lifelong disability or disfigurement. Level 7. Myotoxic venom. The cardiac muscles, which are responsible for keeping your heart beating, are among the muscular tissue that myotoxic venom specifically targets. There are certain species of sea kraits, tiger snakes, and bamboo pit vipers that create myotoxins that have the potential to cause rhabdomyolysis. Rhabdomyolysis is a disease in which the kidneys are unable to filter waste because the muscle is breaking down at such a rapid rate. Some of the early signs include soreness in the muscles, weakness, and urine that is black in color. As the venom continues to cause damage to the muscle, the body will eventually become overloaded with dead tissue, which will ultimately result in the failure of numerous organs, most notably the liver and kidneys. The moment of death may not occur immediately, but if it is not treated, it is unavoidable. In order to survive, victims require intravenous fluids, antivenom, and in some cases, dialysis. Level 8. Complex venom, multi-system attack. Certain animals that are considered to be among the most dangerous in the world do not rely just on a single form of venom. Rather, they employ a combination of hemotoxins, neurotoxins, cytotoxins, and myotoxins. As a result of this venom cocktail, sufferers experience failure in multiple systems. One of these creatures is known as the box jellyfish. It is possible for its venom to attack the skin, neural system, and heart all at the same time. After being stung by a box jellyfish, it feels as though you have been branded with acid. The victims frequently experience cardiac arrest, paralysis, shock, and necrosis of the skin within a matter of minutes. Death can take place in fewer than 3 minutes. As a result of the neurotoxic substances found in jellyfish, even those who survive may experience a persistent condition known as Irritating syndrome, which is characterized by persistent agony. Level 9. Delayed lethality venom. It is possible that certain varieties of venom do not immediately result in death. Rather, they set off a time bomb within your physiological system. Upon initial inspection, the venom that is secreted by organisms such as the cone snail appears to be completely innocuous. On the other hand, the sufferer may begin to develop symptoms such as loss of eyesight, paralysis, and collapse of the breathing system within a few hours of the incident. To inject conotoxin, which stops nerve transmission at the molecular level at the same time, cone snails utilize a tooth that resembles a harpoon. This tooth is used to inject the substance. At this moment, there is no antidote that can be administered. The placement of ventilators on patients and the ongoing monitoring of their condition is an absolute necessity. Which of them is the most terrifying? Individuals have been known to pass away while sleeping hours after being stung, and there have been instances of this happening without any prior warning. Level 10. Instant lethality venom. With only a small amount of venom, these monsters are capable of killing a human being in a matter of minutes. They are at the height of venom power. 1 milligram of the venom that is extracted from the inland taipan, which is commonly referred to as the fear snake, is an extremely toxic substance that may kill 100 humans. Venom is composed of neurotoxins, hemotoxins, and myotoxins, all of which are extremely dangerous. The Brazilian wandering spider is still another possible possibility. This spider has the capability of causing severe pain, hallucinations, paralysis of the muscles, and even asphyxiation in addition to its other potential effects. Its venom has the potential to cause a dangerous rise in blood pressure, which can lead to medical complications such as a heart attack or a stroke. When it comes to speed or size, these organisms rely on chemistry rather than either of those factors, which is nearly unmatched. Thanks for watching. If you enjoyed the video, don't forget to like, subscribe, and hit the bell icon for more awesome content. Stay safe, and we'll see you in the next one.